Welcome back. Children experience some unbridled changes as teenagers, which can be confusing sometimes. Physical, emotional, and social changes, including exposure to poverty, abuse, can make adolescents vulnerable to mental health problems. So globally, it's estimated that 1 in 7 10 to 19-year-olds experience mental health conditions, yet these remain largely unrecognized and untreated. So as we continue to mark Teen Suicide Prevention Week that runs from the 14th to the 21st of February, we speak about how parents can spot the red flags regarding teenagers' mental well-being. We speak now to Johan Lombard, who's a clinical manager at Life Healthcare. Mr. Lombard, a very good evening to you. Thank you so much for speaking to us. It seems that people are becoming more and more accustomed to be talking about mental health. We see it on social media, people becoming more and more open to it. But the acceptance of what is mental well-being or illness and when one is in danger of a mental health crisis, has that become commonplace?
I think what's starting to happen is more people are talking about it. So yes, there is a less of a stigma attached to it, but there is still a lot of fear to talk about what it really means and what it means for teenagers especially.
Okay, so when we talk about firstly, is there a difference in how mental health issues or problems are experienced by teenagers and how it's experienced by adults?
In some senses, yes. With the teenagers, because they haven't got all the coping skills and experience that adults have, they do experience it differently. Also, a lot of the emotions, they still don't understand what it actually means to them. So they're having a feeling, but they can't label it.
I'm actually just thinking about a story that we did yesterday about childhood cancer and how the report actually says it seems to become more prevalent now because it's being reported on more. And I'm just wondering, are we seeing a greater number of suicides in this generation, or is it because it's been spoken about more?
I think it's a combination of both. Social media plays a huge role in this. So more people are aware of what's happening. But we have seen that there is an increase in teenage, especially teenage suicide.
So what signs should parents be looking out for, particularly if they are warning signs that their teenager is depressed or on the verge of suicide?
The first thing is usually there's a behavior change. So that a child might suddenly start sleeping more often or sleeping longer hours, or a change in just the sleeping pattern. Less sleeping, the eating patterns might change, and then also starting to withdraw, not finding enjoyment in some of the normal activities that the family used to do, and just by starting to isolate. These are a lot of the things that's initially recognizable. And you can immediately see when a child starts withdrawing, that they don't want to go out with the family. When there's a function, they will rather stay home alone. Also, they start seeing less of their friends and start finding excuses not to go out.
There's a report that you shared with us that seems to suggest that young black males are more prone to being depressed and likely to commit suicide. I want you to talk about how true this is. And I'm asking this against the backdrop that the black demographic is the majority in this country. So could that be the reason, or is this reflected in other parts of the world as well?
It is mostly because of our demographics, but then the second part of that is also the stigma that's still attached in a lot of families regarding mental health. Not talking about it, not asking the difficult question of, do you ever think about killing yourself? Because a lot of the time when you ask the difficult question, you're going to deal with a difficult answer, which might mean, yes, I am thinking about it. And a lot of parents are scared to ask that question. And that goes about for all demographics.
And I suppose one has to be accepting of the concept of mental health or well-being and understand, as you mentioned, the science, but what facilities are there to help? So how can parents help teenagers to overcome depression and suicide? And what public education programs are there, particularly for parents?
So Within the private sector, there's quite a lot of facilities that do offer assistance, especially for adolescents and the parents. In the public sector as well, one of the main things is that education starts before school. So it starts before the child actually goes to school. And a lot of them is to start listening to what the child's saying, building a relationship between the parents and the child, that they can feel free to talk about things, that there's not always just we step in when there's a problem. So in the public sector as well, there's a lot of NGOs, NPOs that is willing to assist, that is free of charge. And then you've got your government huge facilities as well, that is starting to really reach out to the communities.
What type of services does Life Healthcare offer? Does it have to end in inpatient assistance, or do you have short-term interventions that you offer?
So we do have the inpatient facilities, but part of that is there's a multidisciplinary team that works with the hospital. So we've got occupational therapists, social workers, psychologists, psychiatrists. All of that is available. And a lot of the time, early intervention can assist the child to be seen and assisted before they actually need inpatient care.
And what is more effective, particularly for teenagers? Is it group interventions or is it individual therapy? Especially if you're speaking about the need to have people who destigmatize it so that they see that there are other people within their cohort who actually suffer from that or who can overcome it.
The group therapy side of it actually does help a lot, because for a lot of our teenagers that we've got at our facilities, just knowing that somebody else is feeling the same is already a comfort. Then it becomes almost, it's okay not to be okay. And that assists them in talking more about it. The individual therapy then will just broaden what has happened in groups and help to clarify what the teenager is going through.
Just finally, in South Africa, particularly amongst teenagers, what is the greatest source of mental health challenges?
The greatest source of mental health is, especially with teenagers now, is the media, and in the sense of the bullying, online bullying, where in the past, if a child was bullied at school, they can at least go home to a safe environment. Now with social media with them the whole time, the bullying doesn't stop. So it continues and continues. And I think it's also, there's a lot of fear within South Africans at the moment. What is the future holding for us? What's going to happen? And this also affects all teenagers.
Thank you so much for speaking to us and sharing with us the work that you do. Johan Lombard is Clinical Manager at Life Healthcare. Well,